Hello doctors, welcome to today's video. Let me start with a story I know many of you will relate to. Dr. Emily Carter, an internal medicine physician in Austin, Texas, was running a busy clinic serving hundreds of patients each week. Her goal was always clear: spend more time caring for patients, and less time drowning in administrative work. But there was one thing consuming her team's energy: endless phone calls. Day after day, staff spent hours calling patients with lab results, reminders, or follow-up instructions, only to land in voicemail. Most of those voicemails were never even heard. Patients ignored unknown numbers, staff got frustrated, and critical care instructions were delayed. What Dr. Carter was facing is what many of us face across the country: administrative burnout caused by outdated communication methods. Here's the truth: phone calls aren't working anymore. Over 60% of calls go unanswered. Surveys confirm that 61% of patients actually prefer secure text-based messages instead of calls. Patients want convenience. They don't want to be interrupted at work or with family. And as physicians, we want communication that is reliable, secure, and effective. That's why Dr. Carter decided to shift from phone calls to secure messaging. She partnered with Staffingly, a healthcare outsourcing company that specializes in HIPAA-compliant messaging across SMS, iMessage, WhatsApp, and more. Here's how it worked. Patients opted in easily during check-in, giving one consent that covered all platforms. When an appointment was missed, a lab result was ready, or a medication reminder was due, the system triggered an instant secure message. Patients replied at their convenience, and the clinic stopped wasting time with phone tag. Staffingly's team even managed the entire process, sending updates, handling routine questions, and escalating only the complex cases to clinic staff. The results were transformative. 98% of messages were opened. Response rates jumped from under 10% with phone calls to 45% with messaging. And productivity skyrocketed, with one coordinator able to manage 50 or more message threads at once. Patients were happier, and staff finally had breathing room. And here's why outsourcing to a partner like Staffingly makes sense. Staffingly makes it simple: instant compliance, secure multi-platform support, cost savings, and the peace of mind that every message is encrypted, logged, and auditable. For doctors and healthcare providers, this isn't just about technology. It's about restoring time to patient care, reducing burnout, and creating communication patients actually respond to. So doctors, if you're still stuck chasing calls, maybe it's time to think differently. Patients are ready to engage, but on their terms. Secure messaging is no longer optional. It's the new standard. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more insights on improving healthcare communication and patient engagement.